Hi there. My name is Kim Fernandez, and I'm the prenatal teacher here at the Toronto Doula Group. I'm also one of the doulas as well. Thank you for choosing us for your childbirth education needs. In this day and age, when so many hospitals are canceling their prenatal classes or putting them online, it's important to find one that is going to be informative, unbiased, and hopefully a little entertaining. The other big difference between a standard online class offered through public health or your local hospital is that we at the Toronto Doula Group will be here for you after the class is over. If you have questions or you need clarity on what was discussed, we'll be there to answer them for you. At the end of this session, I will give you the ways in which you can contact us. All right, so let's get into this. What we're going to learn in this class is identifying the various body parts in the pregnant body, describing what those body parts do and why they're important for pregnancy and birth and pushing, and learning some tips and tricks about the aspects of labor and delivery that can help. This class is not designed to get you ready for labor and delivery, but it's the first in a series of classes that we teach. We're offering this one for free to give you a bit of an idea of what our teaching style is like, and hopefully you'll take the rest of them. So let's get started. The fundus is the top portion of the uterus, and it's what your care provider is using to measure from the top of the fundus to the top of the pubic bone. They do this because, in theory, in centimeters, it should equal the number of weeks pregnant that you are. If it is measuring a little bit big, they might be concerned that there's maybe too much amniotic fluid, or maybe there was a baby missed, though that's not likely in this day and age. If you're measuring small, they may be concerned that baby is not getting what they need from the placenta or the cord. So you'll have ultrasounds to make sure that everything is going well. Next is the amniotic sac. This is a clear membrane that grows out from the placenta, and it's going to hold in baby, and it's going to hold in all the fluid. At some point in your labor, it will break. In Hollywood, it breaks 100% of the time as the first sign that labor is starting. In real life, that actually only happens about 10% of the time. So you don't have to sit on garbage bags or coat your bed in a tarp. Odds are your waters will break at some point during your labor, probably closer to the middle or end. Speaking of placenta, the placenta is an organ that is specifically grown for pregnancy. Humans are really cool. Birthing parents especially. You give them a little bit of schmutz, and from that, they grow an entire human. And to support that human, they're going to grow an entirely new organ, and this is the placenta. It attaches to the lining of the uterus, and it's going to bring into baby nutrients, oxygen, hormones, all the things that baby needs to grow, and it's going to filter out baby's waste products. The problem with the placenta is it is actually very little filter at all. So anything like medication, smoking, alcohol, recreational drugs, anything that's going to go to your bloodstream is going to go to baby. So this is why your care providers want you to be careful in the early stages of your pregnancy to make sure that everything is very healthy and safe for baby. When the baby's born, the uterus will actually start to shrink down. And when it does that, the placenta can't hold on anymore and it'll peel away from the lining of the uterus. When that happens, you'll have to do probably another little grunty push to get to the placenta out, but it won't be anything like what you had to do to get baby out. When it comes out, the care providers will have a look at it and make sure that it's all good and happy and healthy, and then it goes away to biohazardous waste. Or you can ask to keep it and either encapsulate it, or you can plant it and plant a tree over it. But either way, whatever you decide to do with your placenta, make sure that you let your care providers know ahead of time. The amniotic fluid, which is a clear liquid, odorless liquid that baby is floating in, is a shock absorber for baby. So they're pretty packed in there, and bumping things or tripping over things, baby's actually really safe. They are using this amniotic fluid to also practice breathing by breathing it in and breathing it out. And they are also swallowing it and peeing it out. The one thing to remember though, when you are at home, if your waters break at home, we need to make sure that the waters are clear. They could be tinged with blood, which is normal, but we want to make sure that the amniotic fluid isn't greenish or brownish in color. If this happens, what it means is that babies had their first poop on the inside. Babies don't poop on the inside. They pee on the inside, but they save the poop for you for afterwards. If there is, and it's called meconium, if there is meconium in the water, then it will mean that baby could have been under some type of stress. It doesn't mean that they're under stress at that moment, but at some point they could have been. So what will happen is that there will be an extra person in the room when you deliver baby, and that will be somebody from the pediatric team, pediatric nurse, pediatric respiratory therapist, a pediatrician, just so they don't inhale, just to make sure the baby doesn't inhale any of that stuff when they take their first breath. Now, if there is meconium in the fluid as well, it could also mean that maybe babies just had their first poop, and they're, especially if you go over that 40-week date, it just means that they're starting to work. So it used to be that it was an automatic cesarean birth if you had meconium in the waters. But as I say, nowadays, we will monitor you and baby a little bit more closely, and that a vaginal delivery is perfectly possible. The pubic bone, that is going to be, as you can see where it is, that's going to be baby's limbo stick to get under, to get out. So the pubic bone, baby is going to come into the pelvis. Let's see if I can get my baby here. Baby's going to come into the pelvis, and through pushing is going to, they're facing the wrong way, through pushing, their head will mold to come out from underneath the pubic bone. Now, it'll be important during the pushing stage to make sure that you are using as upright a position as possible. So either semi-sitting, upright, forward leaning, or side lying to help create the space that baby needs to get through and underneath the pubic bone. The longest part of pushing is going to be to get baby's head molded to fit underneath that pubic bone. So pushing could take a couple of hours. That's not uncommon. Now, as you can see where baby's head is in relation to the bladder there is quite squished, and that's because baby has fit further down into the pelvis. Right now, your bladder is more open because baby's sitting higher up. But as you get closer to the end of your pregnancy and baby fits down further into your pelvis, your bladder is going to be quite squished, and it's going to take you'll have to be peeing every 5 minutes now. But it'll be important during the labor itself that you make sure that your partner or your support person is getting you to go to the bathroom periodically, at least every 45 minutes or so. And the reason is the "I gotta pee" message doesn't always make it up to your brain with everything that's happening down here. So make sure that you are emptying that bladder frequently. If not, then they'll have to give you a catheter, but also it can cause contractions to be more intense, and it can also cause the labor to be a little bit longer if baby is prevented from moving into the vaginal canal. Now, the vagina, this for many will be the exit route. This will be where baby comes out. And it is stretchy and it is elasticy, and it will go back to its pre-pregnancy state after you have the baby. Sex after you have a baby is not different because your vagina is all stretched out. It's actually different because there's now a baby there all the time. And even when the baby is at grandma's or you're away for the weekend, it lives in here. So we don't want anything to go back into the vagina after a baby has come out of the vagina, at least for 6 weeks afterwards. It's been through a lot. It's got a lot of healing it needs to do. So make sure that you are keeping everything out of it. That includes tampons and penises and anything else. So make sure that it is not being, not, make sure that nothing's going into it. I'm not editing that out. All right. Now the other side of the coin is the rectum. When you become fully dilated, it's going to feel like you have to have a bowel movement. And that's not a bowel movement. That's going to be your baby, because we grow humans and we grow organs, but we're not going to grow new muscles to push this human out. We're going to use the ones that are already there, and they happen to be your rectal muscles. Oh my gosh, does that mean I'm going to poop on the table? Yep, potentially you can. Now, I wouldn't worry about it, because if you do, nobody cares. The nurse will be discreetly wipe it away, or the midwife will discreetly wipe it away, and nobody will be the wiser. But the other thing that happens is During the early stages of labor, or even before labor starts, your body will actually cleanse itself and it'll flush all that stuff out of its system. You'll get loose bowels. You might even feel like you have the flu or that you've eaten something bad. And then by the time you get to active labor, you're likely not eating. So by the time you get to pushing, there likely isn't anything there. And if there is, it's just a small amount. And as I say, the nurse will discreetly wipe it away and nobody will be the wiser. And the problem is if you're going to hold back from pushing because you're afraid to poop on the table, well, that's going to result in potentially the hospital staff actually helping you get baby out. And that help could come in the form of a vacuum extraction or a forceps delivery. A little bit of poop doesn't seem like that big of a deal anymore now, does it? So if you poop, you poop. And really, let's be honest, your whole life is going to be about poop from this point forward. So better get used to it. Now, the perineum is the space between the vaginal opening and the rectum. And this will get stretched the most during baby's delivery. The tearing of the perineum is not uncommon in first-time birthing parents, but there are things that you can do to minimize the damage to the perineum. Trying, as I mentioned, to push in as upright a position as possible can take some of that pressure away from the perineum. And also doing some perineal massage before labor begins and during labor will also be helpful. In your handouts, there's a article on perineal massage before labor starts that you can go through, and basically using clean hands, short fingernails, a little bit of olive oil, coconut oil, or water soluble lubricant. You're basically just going to do some light stretching around the base of the vaginal opening or some massage around the inner and the outer. And the reason we do this is because the perineum itself is a muscle. And if the muscle is very tight and not stretchy, then what can happen is as baby moves down, it can actually tear. If you imagine going to work out, lifting weights, all of that, but you haven't stretched beforehand, you could actually injure yourself or tear your muscle. This is the same idea. Basically, perineal massage before you go into labor is going to be like doing those stretches before workout. It's going to be like yoga for your perineum. Okay. You don't want to go crazy with it, but it can be very helpful to minimize the damage that might happen during your pushing stage. During the pushing stage, usually the nurse or midwife will do some perineal massage at the bottom to try and stretch things out more gradually. And pushing that isn't like it is on television where it's like, we're trying to rocket this baby out. Basically, what we're talking about is trying to push on the contractions that you have, and that doing three pushes with each contraction, and that will bring baby down a little and scooch back up, and then bring down a little more and scooch back up, all the while stretching and stretching and stretching. This will also help minimize any tearing down there. So we don't want to rocket this baby out, and you want to prepare ahead of time, and perineal massage can do that. Now, the cervix is very long and very thick, and before labor starts, it actually feels quite firm like your forehead, and then it gets a little bit softer as labor is going to be coming on, or even before labor starts, and then it's going to end up being really soft and squishy like your cheeks. We're looking for the cervix to eventually open to 10 centimeters. The funny thing about that is if your baby's head is bigger than 10 centimeters in circumference, it doesn't have to get to 10. If your baby's head is smaller than 10 centimeters in circumference, it doesn't have to get to 10. So basically what you'll see at the end, if they do a vaginal exam to see if how dilated you are, as long as there's no cervix around the widest part of baby's head, they'll say you're fully dilated. So if, as I say, they probably won't say that you're 10, they'll say that you're fully. And that means now that baby's head can pass through the cervical opening without any hindrance. Now this one can be a little bit confusing. It's not really labeled in the picture that you have there, but the white mark at the inside the cervix there, that's the mucus plug. It's actually a little bit thicker than that. It's basically a buildup of mucus that is a plug. It's a line of defense against infection during the pregnancy. And as you get closer to the end of your pregnancy, your cervix actually will start to soften and open slightly, even before labor starts. And when that happens and the cervix starts to loosen up and get softer and open slightly, the mucus plug, which is being held in there by pressure, falls out. It could fall out in one chunk, which is really not very much. It could come out little bits at a time. It could come out just very stringy, and it could also be tinged with blood. Bleeding is actually a normal part of the labor process, and it's happening as the cervix is thinning and opening. Blood vessels are breaking as the cervix opens. So the bleeding itself isn't coming from the uterus, it's actually coming from the cervix. So the more bleeding you have or bloody show, the more dilated that you are. The When the mucus plug falls out, if this is your first time, if you haven't had a baby before, then labor's not imminent. If you're a first timer, when you see or if you see your mucus plug, we're basically talking about labor starting maybe a few days to even a couple of weeks away. The cervix will start to soften days to weeks before labor is actually going to start. So going to the hospital when you have your mucus plug fall out, not a good idea. They'll send you home for sure. The what else? Oh, something else that can happen with the mucus plug when it falls out is just built in behind it between the cervix and the amniotic sac is some very thin watery mucus. And when the mucus plug falls out, it can feel like a trickle of fluid, which might have you confusing it with your waters breaking. So the way to tell whether it is your waters breaking or if it's actually just that mucus is if it's just a one-shot deal, it's just one trickle and it doesn't happen again, that's all it is. If your waters have truly broken, you will actually continue to trickle fluid even up until baby is born. The other thing is if you can stop that flow with a Kegel, you actually just peed yourself. So that one can be a bit confusing, but it's nice to sort of, if you feel that trickle, just wait and see if in another 20, 30 minutes, if it's happened again. And if it did, yeah, potentially your waters have broken. Now, the umbilical cord is for some of you, there could be about 3 feet of cord in there. And if I'm not mistaken, your baby's auditioning for Cirque du Soleil. The cord itself is going to bring in those nutrients and oxygen and hormones and all of that stuff into baby. And at some point, your baby might actually get caught on it. It's actually not uncommon for baby to be born with the cord around their neck. And we have to consider that's not necessarily that big of a deal. And the reason is that baby's not breathing this way. They're actually breathing through the cord. So as long as the cord isn't being impeded in any way, then we're good. The only time it becomes an issue is if it's maybe a couple of times, if it's wrapped around something that's preventing baby from moving down into the vaginal canal, then yeah, we probably have a problem. Or if it's being pinched in some way. And baby will actually tell us if there's an issue with the cord, and that will happen through their heart rate. So even if you haven't been uh, continuously monitored through the labor itself, you will be monitored through the pushing stage because baby's heart rate is going to tell us if there's an issue. And when baby's born, the care provider will feel around the neck for cord, and if there is any there, they'll move it out of the way, and then the rest of the baby is born. Your partner will be able to cut the cord if they choose. There's no pressure to do it. Don't decide now, decide at the time. But the optimal time to clamp it is really any time after 1 minute. And in another session that we have, when we talk about baby's first 24 hours, we talk about the benefits of doing that. And yeah, if your partner does choose to cut the cord, then you're going to have to put a little bit of elbow grease into it. It's actually a pretty tough little organ. There's no nerve endings in it, so you don't have to worry about hurting anybody. The birthing parent or the baby won't feel it. And you'll probably have to get in there and cut quite difficultly. The care providers will clamp in 2 spots and you'll cut in between there, and then they'll make sure you're not cutting off anything that doesn't need to be cut off. And then that will then that all goes away and baby will have their little umbilical cord stump on their belly. All right, the spine. So this is where the epidural goes. And generally speaking, it also has to do, the spine is also plays an important factor in the fact that what we want to happen is for baby to enter the pelvis facing your back so that, as I say, when they push, baby will head will mold and come out that way. Now, sometimes baby's GPS is a little bit off, and sometimes they actually come into your pelvis facing your front. And when that happens, we now have baby's head putting extra pressure on the tailbone and the back of your spine. It causes what's called back labor, and it's very uncomfortable. We have to remember that the back of baby's head and their spine is the heaviest part of their body. And if you're constantly laying back or chilling out, that's going to pull baby into that, what we call OP position, occipital posterior. So, particularly during this time of COVID, because we haven't been going out as much as we used to, we have seen quite a large increase in breech deliveries or breech babies and OP babies. So, it'd be important to make sure that you are being more mobile during your pregnancy, that you are doing maybe some online yoga. There's lots of online yoga nowadays. Um, and trying to be more conscious of your positioning during labor. So upright forward leaning positions during labor will also keep baby in a good position as well. And finally, the uterus. The uterus is an amazing organ that is actually a giant muscle. So it's 3 muscles that work together in conjunction, and the outer layer of muscle fibers of the uterus are long like this. The inner layer provides, or the middle layer provides blood to the inner and the outer, and the inner muscle fibers are circular in nature and concentrated close to the bottom of the uterus, which is the cervix. So what happens in a contraction is those long muscle fibers will squeeze together and pull those circular muscle fibers up over baby's head. And that's all a contraction is. It's just like any other muscle contracting. After baby is born, as we mentioned, the placenta will come out. And when you leave the hospital, you'll probably still look about 4 to 5 months pregnant. So we want to be kind to your uterus. It has grown an entire baby and it has pushed that baby out. So we want to make sure that it is at least being cared for. You can use belly bands and things like that, but at least for a couple of days, give your uterus a bit of a rest. Afterwards, you can use those belly bands, but you want to make sure that you're not using them high up on your waist. What you're doing is actually using them around your uterus and around your hips, and that can be very helpful. Trying to see a pelvic floor physiotherapist as well can be very helpful in making sure that everything is doing what it's meant to do. It will take about 6 to 8 weeks to get back to that pre-pregnancy state. And in another one of our sessions where we talk about your postpartum recovery, we talk about how to care for the postpartum uterus and your bleeding and all of that stuff. All right. Well, I hope you enjoyed this class. It was very quick. And what we can do now, if you do have questions, if you do have any concerns, the email address is there for you to get in touch with us, and we can answer any questions that you might have about this particular session. You can also check out our website for the other classes that we have available. And of course, follow us on Instagram at Toronto Doula Group. And we are on Facebook as well as Toronto Doula Group.